is Brittany Shannon, and I will be presenting an evidence-based article to you today. The name of this article is The Effects of Cold Whirlpool Therapy on Power, Speed, Agility, and Active Range of Motion. This study was published in 2008 in the Journal of Sports Science and Medicine. The purpose of this study was to determine if cold whirlpool therapy affects functional performance over time. This was level 3 evidenced in a non-randomized single group study using repeated measures with a pre-test, post-test design was used. 21 participants were recruited through convenience sampling. One participant dropped out during the study due to injury. Participants participated in 4 sessions. Each of these sessions were 1 hour long, addressing a different area of functional performance. The areas were again power, speed, agility, and active range of motion. A pretest was given. Then participants lowered their lower extremities into a cold whirlpool up to the fibular head for 20 minutes. The cold whirlpool was at a temperature of 10 degrees Celsius, and this was monitored by a thermometer at the bottom of the cold whirlpool. Participants then completed post-test assessing counter movement vertical jump test for power, a 40-yard dash for speed, a standard T-test for agility, and goniometer measurements of dorsiflexion, plantar flexion, inversion, and eversion for active range of motion. Effects were examined at 2 minutes, 7 minutes, 12 minutes, 17 minutes, 22 minutes, 27 minutes, and 32 minutes post-intervention. The strength of this study were that measures were very well described. This is good for replication because future researchers can easily reproduce conditions used in this study. Reliability was also stated for each measure, which means that measures produce a consistent result for what they were trying to measure. Statistical analysis were also done for each measure, and the analysis was appropriate for the data used. All data was analyzed using ANOVA or MANOVA. Results were compared to previous data, which gives insight into how this study filled in holes of previous research and also what needs to be addressed in future research. There were also limitations to this study. There was no randomization in this study, and there was no true control group used. This makes it hard to tell if all extraneous variables were controlled for due to no comparison group. No power analysis was done, so we don't really know if 20 participants is enough for results to be statistically significant. There were also no demographics given for participants, so we do not know how healthy or unhealthy participants were going into the study, which could affect results. There was no validity stated for any measure. All results were also not listed. Some only had means with a star indicating their p-value was significant. All data should be listed so that future researchers can know what to compare to. This study also did not address subjective data, such as how participants felt and any apprehension they had towards or after the cold whirlpool. This could also affect results. This is also sort of hard to generalize to a whole population because the study said they only used healthy participants. So we don't know how other participants might have reacted in the situation. The outcomes that were found were that power was decreased in average and peak power up to 32 minutes compared to pretest results. Speed showed a decrease up to 22 minutes compared to pretest results. Agility showed a decrease in agility up to 7 minutes compared to the pretest. And active range of motion, only dorsiflexion was decreased compared to the pretest at 7 and 12 minutes after cold whirlpool. Plantar flexion, inversion, and eversion showed no significant differences. Now, how can we relate this to our practice as occupational therapists? Well, results indicated that cold whirlpool affects functional performance over time in all of the functional performance measures. So that was power, speed, agility, and dorsiflexion. This can be generalized to patients we treat because anything we do requires most of these functional performance measures. Such things could be walking or driving a car or just performing daily ADL tasks such as doing laundry. We're going to need power, and we're also going to need maybe some speed in different walking tasks, also agility, moving around obstacles in our house, and dorsiflexion for really any activity, walking. Since the cold whirlpool affects these, we need to just make sure our patients are aware that these things are affected. This could cause safety concerns in the long run if they're performing these functional performance tasks after cold whirlpool therapy. We need to advise them to use caution for up to 30 minutes after treatment in some cases. Also, if patients state they have to perform vigorous activity after cold whirlpool therapy, we need to advise them to perform a warm-up. This will wake the muscles back up and prevent injury from occurring due to the changes in strength and stiffness that occur after cold whirlpool therapy. Thank you for your time, and I hope you have a great day.